Welcome to Del Mar Skills and Procedures for Medical Assistants. These programs are designed to teach you the fundamental skills of medical assisting. These programs will provide the proper techniques and procedures, MA tips and testimonial lessons, providing you with the basis for your success as a medical assistant. Welcome to Del Mar Skills and Procedures for Medical Assistants, Program 3, Modern Reimbursement Procedures. Today's medical assistant who processes reimbursement claims must understand and use an alphabet soup of abbreviations and acronyms, including ICD, CPT, HMO, PPO, HIPAA, CMS, and so on. How on earth will you be able to keep them all straight? Because processing health insurance claims has become increasingly complex, it is more important than ever for the medical assistant to be accurate, timely, and conscientious when completing and submitting insurance claims. The medical assistant must also work carefully with patients to understand the requirements and conditions of individual insurance policies. After viewing this program, you should be able to define the reimbursement methods used to compensate medical providers, explain the use of ICD, CPT, and HCPCS codes in insurance claims processing, accurately complete a health insurance claim, and respond to patient questions regarding their health care insurance coverage.
Here are some terms you'll need to learn when processing insurance claims for medical benefits. A claim is generated when a patient receives a service or treatment and wishes to be reimbursed under his or her insurance policy for the charges incurred. The patient may be referred to as the beneficiary. MA tip. The patient may also be called the participant, subscriber, dependent, enrollee, or member, depending on the insurance company. In order for the insurance company to understand what is being billed, the physician will complete a charge slip or encounter form at the time of the patient's visit. This form contains CPT HCPCS codes that describe the type of visit, procedures performed, and any tests that may be required. ICD codes are included on the form to describe diagnoses, signs, and symptoms. MA tip. Other names for this form include communicator, fee ticket, multi-purpose billing form, patient service slip, routing form, superbill, or transaction slip. Becoming acquainted with CPT HCPCS and ICD codes is an important part of your job. Fortunately, all of these codes are organized and described in 3 very important manuals: Current Procedural Terminology, or CPT Manual, Healthcare Common Procedure Coding System, or HCPCS Manual, and International Classification of Diseases, or ICD Manual.
When working with a physician, the physician has to code the particular procedures that were done, or the particular diagnoses that were assigned to the patient. And as the medical assistant, you really need to work side by side with your physician in making sure that the codes are proper so that the actual services can be reimbursed and not denied.
Let's learn more about coding and processing insurance claims by following an insurance claim from start to finish.
Hi, good morning.
Hi, I'm here to see Dr. Young. My name is Pat Morgan. I believe my referral was faxed over by Providence Medical Group.
Yes, I see you're a new patient. Thanks for coming in a little early. My name is Jamal, and yes, I have your referral from your primary care provider. I'll need you to fill out this patient information form. I'll also need you to fill out this privacy policy. The policy basically just says that all your information is confidential. Just sign it to indicate that you've read and understand everything. If you have any questions, please feel free to ask. I'll also need to see your insurance card for your patient record to make a copy. Does your insurance require a copay?
I'm not sure. I haven't used this plan before. I just moved here last spring.
Okay, well, let's take a look here. Okay, here we go. Just to let you know, The number here is for you to call your insurance company to become more educated on your insurance. If you have any questions on your coverage, co-pays, or deductibles, feel free to utilize the number. Your card also indicates a $20 copay with each visit, and it's office policy to collect all copays prior to going back to the clinical area.
Okay.
Okay. Do you have any secondary insurance?
What do you mean?
Well, are you covered under another plan, such as a spouse's plan?
No, I'm not.
Okay. In that case, take your time to fill out the history form completely and have a seat.
Okay, thanks.
Thank you.
A thorough patient history and clear copies of both sides of the patient's insurance card are the foundation of a newly created patient record. If your practice is computerized, you will immediately create an electronic file for the patient. This will include the patient's contact information and details about insurance coverage, including copay amount. Most software will allow you to print out a patient encounter form or charge slip for the physician to complete during the office visit.
Take time to check over the patient history to make sure that nothing was missed. Be sure the appropriate HIPAA forms were completed and provide the patient with a copy.
Here's your insurance card. Let's take a look here. I see that you've completed the history form. The doctor will review your history with you prior to performing the exam. Would you mind if we contacted your current provider for copies of your past medical records?
No, that'll be fine.
Great. Would you like to contact your physician to obtain the records, or would you rather sign this release of information form, which will allow us to contact your physician for the records? Just realize, though, that if you contact your physician for the records, they may charge you for it, for copies. However, if our office contacts your current provider, they don't normally charge us.
I'll just sign the form. It sounds like that'll be easier than having to track down the paperwork.
No problem.
A pre-existing medical condition may not be covered under certain insurance policies, or there may be a waiting period until coverage is allowed. Finding out this information before the patient arrives in the office for the actual appointment is best. But if the patient is in the office, you will need to contact the insurance company immediately to help you and your patient avoid problems later.
When working with a patient, always ask yourself, is the patient covered by health care insurance? Is the procedure covered by the health care insurance? Is the primary care provider performing the procedure? And if not, is a referral and/or authorization code required? Is pre-certification or predetermination needed? Do we need to send the patient to a particular facility for a specified test? Do we have all the information needed?
First of all, I would definitely verify with the insurance company what their policy is with pre-existing conditions so that I understand exactly what's going on with the patient in this case. Probably I would speak with the patient when they come in versus talking about that over the phone, because pre-existing conditions, when people are working through that with their insurance carriers, people could definitely be spending a lot of money out of pocket until the pre-existing clause is no longer in effect. Oftentimes pre-existing clauses can be for 6 months, and that's a long time that someone then is going to have to pay for services out of pocket related to that diagnosis.
This patient's medical record now includes the patient's health history, insurance information, referral slip, and encounter form.
Okay, Pat. I'm all finished with my portion of your visit today. How would you like to take care of your copay?
I have a 20.
All right. Great. All right. I'll just clip this to the fee slip. The clinical medical assistant will be back in a few minutes to take you back to the examining room. It was a pleasure to meet you today.
Great, likewise. Thanks.
The clinical medical assistant's responsibility for the next portion of the visit will be to obtain the patient's height and weight, vital signs, and chief complaint, as well as providing the patient with instructions on how to properly disrobe for the exam. The medical assistant will exit the room and shut the door to provide privacy. She will then hand the chart to the physician.
The physician will review the information and complete the charge slip during the course of the visit, indicating the date and type of service, the visit or consult code, diagnosis code, procedure code, lab tests ordered, and if needed, the date the patient is to return. The record will be placed on the physician's desk in his secure office so he can refer to it when he dictates a note about the patient's office visit later. The physician hands the encounter form to the employee at the checkout desk.
All right.
All right. We will bill today's charges to your insurance. If any charges are not covered by your insurance, you'll receive a statement from our office. The doctor would like to see you again in 6 weeks. Would you like to set that up today?
I'll have to call back after I look at my work schedule.
No problem. There's a card with our phone number on it, and you can schedule the appointment with us. Thank you for visiting with us, and let us know if there's anything else you need us to do.
Great. Thank you.
Take care.
The medical assistant should indicate in the chart that the patient stated that she would call back at a later date to schedule her appointment.
Take a look at the procedure information listed on the encounter form. It includes a description of the procedure and a code number. 5-digit procedure codes are assigned from the current procedural terminology, or CPT manual. Providers use CPT codes in a variety of settings, including medical offices, clinics, home care practices, hospital outpatient departments, and others. There are several sections in the CPT manual, including evaluation management, anesthesia, surgery, radiology, pathology and laboratory, and medicine. In a medical office, the physician will determine the CPT evaluation management level of service, which also determines the charge for an office visit. Other procedures performed during the office visit will also be assigned codes. Medical assistants should be familiar with codes to verify that they match the physician's documentation. Guidelines are printed at the beginning of each CPT section to help you select the appropriate code. For example, this physician selected the code for venipuncture and a number of specific blood tests. However, the physician did not select a code for the test for Lyme disease. Therefore, the medical assistant must find the code by referring to the pathology and laboratory section of the manual. To find the correct CPT code, begin by referring to the alphabetical index located at the back of the manual. Locate the name of the procedure or service, or the name of the disease being treated. The index will refer to a specific 5-digit code or a range of 5-digit codes. Next, refer to the appropriate section heading to select and verify the code. Determine whether a 2-digit modifier should also be assigned. A modifier provides additional information about the procedure or service performed. If applicable, select the modifier that clarifies the procedure performed and enter the code on the insurance claim. Another coding manual used to assign procedure or service codes in the medical office is HCPCS, or Healthcare Common Procedure Coding System. This manual was developed to process claims for procedures or services provided to Medicare and Medicaid beneficiaries. The HCPCS system consists of 2 levels of coding. Level 1, CPT codes and modifiers as described previously, and Level 2, national codes for non-physician services such as durable medical equipment, ambulance services, supplies, and medications. These codes are alphanumeric and supplement CPT codes. MA tip: if the CPT manual does not contain a specific code for a test ordered, refer to the HCPCS manual to select the appropriate code.
Probably the most common coding situation that we would get into that could be rather frazzling is when a patient presents for one thing. For instance, they present for a headache, and during the exam, the physician ends up coding it as a wellness exam. So, just as one example, patient feels they're presenting for one thing, but the physician ends up coding it something else. The reason that one in particular is rather challenging is that wellness benefits are limited with insurance plans, preventative care, and especially if you're dealing with an adult. So they might be eligible for only one per annual every 365 days, or they could be 1 in 5 years. And so if the patient feels they're coming in for an illness per se, but then the physician codes it as a wellness, well, usually you'll get a deny, not necessarily a denial, but you won't get payment on the claim. And so therefore you'll be billing the patient, letting them know that the insurance didn't pay it and why. Well, what happens immediately, they don't call the payer, they call you at the doctor's office and ask you, why is my claim not paid? So you try to explain it, because you also have the explanation of benefits telling you why. And then as soon as you tell them that their wellness benefit was maxed for the year or wasn't applicable for that service, I didn't come in for an annual exam. What are you talking about? And so the patients get really frustrated because, again, in their mind, they presented for one thing, but the physician during the assessment didn't find that or couldn't see that.
Moving on to the diagnosis. The physician has indicated joint pain in multiple sites, but has not selected the diagnosis code. The MA must refer to the current International Classification of Diseases Clinical Modification Manual, or ICD-CM. ICD-CM disease codes are used to report patient diagnoses in a variety of healthcare settings. Settings may include physician offices, ambulatory care centers, outpatient hospital departments, inpatient hospital settings, and others. In addition to the diagnosis codes, there are ICD codes that are used to document procedures performed during inpatient hospital care. The ICD-CM is divided into an index and a tabular list. It also includes a list of codes used to report external causes of injury. The index is an alphabetical list of terms and the corresponding codes. After locating the disease, injury, or symptom code in the index, verify it in the tabular list. The tabular list is divided into chapters based on the anatomical system or condition. It contains all categories, subcategories, and codes in numeric order. ICD-CM codes have 3-character category codes before the decimal point. Additional subcategory and extension characters may be required after the decimal point. It is important to note that if an ICD-CM subcategory or extension applies to a particular patient's diagnosis, those characters must be used for the complete diagnosis code. MA tip. When a category has no subcategories listed, the 3-character code is a complete diagnosis code.
Oftentimes when you have patients who receive bills because a claim has been denied for a service, their favorite line is, can't you just change the diagnosis? Go ahead and change it. Insurance companies have millions of dollars. Why can't you change the claim? Please just change it. I want to talk to the doctor. And people are very adamant about it. They're very passionate about their medical bills. Very passionate. And so what we tried to tell them, obviously, first we do have to pull that chart and look and see, was it coded appropriately? Is it as it should be? Because mistakes happen. And if indeed it is coded appropriately, we might take it to the physician and say, patient has called, here's what they're stating, here are your notes, does this stand as it is? If the physician says yes, most definitely, which is the case most of the time, we have to convey that to the patient.
Are these the encounter forms from yesterday afternoon?
Yes, they are. And a couple from this morning.
Has anyone checked them for missing codes?
Yes, I did myself.
Well, if you did them, I know they must be right. I'll go ahead and enter the changes.
The CMS 1500 is the insurance claim accepted by insurance companies. It contains all the information needed to process a claim. Even though most insurance companies accept the CMS 1500 claim, each may require that it be completed in a particular way. MA tip. If entering the claim electronically, turn on your keyboard's caps lock to enter information using all capital letters. Do not use punctuation on the claim. Let's follow along as Donna completes a CMS 1500 claim for Pat Morgan. Examine the photocopy of the patient's insurance card to make sure it is legible. Verify that the patient's signature is on file for assignment of benefits and release of information, and for the purpose of processing the submitted claim. Block 1. Pat's insurance carrier is an HMO, and it is not listed at the top of the claim, so Donna enters an X in the Other box. Block 1A. Enter the patient's insurance identification number, for example, Social Security number. Block 2. Enter the patient's name exactly as it appears on the insurance card. Block 3. Enter the patient's birth date using 8 digits, with spaces between each, month, day, year format, and enter an X in the F box to indicate the patient's gender.
We had 2 patients with the same exact names. They both were about the same age, and they both had very similar diseases. They both had asthma and diabetes. I kept getting these phone calls from this patient, or both patients actually, because they were upset because they kept getting billed for things that they never had done. When I started investigating, I found out that my medical assistants were not paying attention to detail and were not asking the patients their birth date when they came in to the office. As a result, we had to write off both women, both patients. We had to write off both their accounts because we couldn't prove who came in on which occasion. So as a result, we lost thousands of dollars. Very important that you pay attention to detail and that you get the patient's birth date and identify that along with the patient's name when they come into the office.
Block 4. Enter the insured's name. The patient and the insured may not be the same. For example, the patient may be the insured's child or spouse. Block 5. Enter the patient's complete address and telephone number, including area code. Double check for accuracy and do not enter any punctuation. Block 6. Enter an X in the spouse box to indicate the patient is married to the insured. Block 7. Enter same on the first line and leave the city, state, zip code, and telephone blank. Block 8. Enter an X in the patient status box to indicate marital status. In this case, the patient is married. Enter an X in the appropriate box to indicate whether the patient is employed, a full-time student, or a part-time student. If none of these are applicable to the patient, leave blank. Block 9 through 9D. If the patient has secondary insurance, enter the pertinent information. If the patient is not covered by secondary insurance, leave this section blank. Block 10. Enter an X in the appropriate boxes to indicate whether the patient's condition is related to employment, auto accident, or other accident. Block 11 through 11D. Enter the insured's policy group, FICA number. Because the patient's husband is the insured, enter his date of birth, month, day, year, and indicate his gender by entering an X in the appropriate box. Enter the insured's employer name and insurance plan name. Enter an X to indicate whether the patient is covered by another health benefit plan. If the patient is covered by another plan, enter that information in Block 9 through 9D. Block 12. Enter signature on file to indicate that the patient's signature is on file in the office. If the patient's signature is not on file, have the patient sign the printed claim. This release of information block allows the medical office to release diagnosis and procedure codes to the insurance company for the purpose of processing the CMS 1500 claim. If the insurance company requests copies of medical records, the patient must sign a separate authorization to release that information. Block 13. Enter signature on file to indicate that the patient's signature is on file in the office. If the patient's signature is not on file, have the patient sign the printed claim. The assignment of benefits block indicates that the patient has authorized the insurance to pay the physician directly for procedure services performed. This means that the patient will not receive a check. MA tip. If the patient refuses to sign this block, or the form that is filed in the patient's medical record for this purpose, the patient receives the check from the insurance company, and the medical office must bill the patient to receive payment. Block 14. Enter the date, month, day, year, the patient's current illness, injury, or pregnancy began. Block 15. enter the date, month, day, year the patient was first treated for the same or similar illness. If unknown or not applicable, leave blank. Block 16. If applicable, enter the dates, month, day, year the patient was unable to work. If unknown or not applicable, leave blank. Block 17. If applicable, enter the name of the referring physician. Otherwise, leave blank. Block 17A. Enter the referring physician's ID number. Otherwise, leave blank. MA tip. For Medicare, it's the physician's UPIN. For other insurance companies, it's the ID number assigned by the company. Block 18. If applicable, enter dates of hospitalization, month, day, year. Otherwise, leave blank. Block 19. If the specific date of illness is not known, enter the date of the patient's appointment. Block 20. If lab work was sent to an outside lab, enter an X in the Yes box. If an outside lab was not used or the patient didn't have lab work performed, enter an X in the No box. If an X is entered in the Yes box, enter the total charges to be billed. Block 21. Enter ICD codes on lines 1 through 4. Do not enter the decimal point because it is pre-printed on the claim. Block 22. If Medicaid assigned a resubmission code and/or original reference number, enter it. Otherwise, leave blank. Block 23. If Medicaid assigned a prior authorization number, enter it. Otherwise, leave blank. Block 24. Enter the date of service, month, day, year, without spaces, in column A. Enter the place of service code in column B. Enter the type of service code in column C. Enter CPT and/or HCPCS codes and/or two-digit modifiers in column D. Do not enter the hyphen between the CPT or HCPCS code and the modifier. Enter the diagnosis code reference number from block 21 in column E. Enter charges in column F. Do not enter the decimal because it is represented on the claim by the broken vertical line. Enter the number of days or units for the procedure service provided in column G. For Medicaid patients only, if the patient was seen under the ESPDT family plan, enter an X in column H. Otherwise, leave blank. For Medicaid and Medicare patients only, if the patient was seen for an emergency, enter an X in column I. Otherwise, leave blank. Leave columns J and K blank. Block 25. Enter the physician's Social Security number or Federal Employee Identification number, whichever is applicable. Enter an X in the box to indicate which is reported on the claim. Block 26. Enter the patient's account number, which is assigned by the medical office for internal tracking purposes. Block 27. Enter an X in the appropriate box to indicate whether the physician accepts assignment for payment. Accepts assignment means the physician accepts as payment in full whatever the insurance company reimburses for procedures, services provided. Block 28. Enter the total charges. Enter a space instead of the decimal point. Block 29. Enter the amount the patient paid for services, procedures performed. For example, copayment. Enter a space instead of the decimal point. If the patient did not pay anything, leave blank. Block 30. Enter the balance due using a space instead of the decimal point. Block 31. Enter the physician's complete name and the date, month, day, year, without spaces. Block 32. If dates are entered in blocks 18 and/or 20, enter the complete name and address of the facility. If known, enter the facility's PIN number below the address. Block 33. Enter the physician's name, address, and telephone number. If required by the insurance company, enter the physician's PIN number and group number.
Hey, Geneva, how's it going?
Hey, Jamal, you must have been busy yesterday. I really had to hurry to post all of the charges. The office manager is expecting this report on her desk in 20 minutes.
Well, what can I do to help?
Can you make one more copy for me? I need more paper.
Okay.
Okay. And then I'll double check the patient statements and look over the day sheet and the claim log, okay?
Sure, no problem.
Thanks a lot. Here's the sheet.
Right.
Thank you.
Oh, thanks, Geneva. I've been looking over the claim log. I'm thinking about using a clearinghouse to handle all the electronic claims.
Why? Have I been making mistakes I don't know about?
No, it's not that at all, Geneva. But the turnaround time on claims will be faster. And they screen all the codes to verify that everything is correct. You know, it would make your job easier, too.
Well, I'm all for that, but why now?
Well, here's a stack of claims that were recently rejected. More than we've ever had in 1 week.
Really?
Yeah. Small errors, really, and not on your part. When I checked the original encounter forms, these 3 claims have strange Social Security numbers, so they were rejected. It could be typos or a patient error. If it's a typo, then we made the error. And the medical assistant who is posting the charges should verify the information that it is correct. Here are 2 more claims that were rejected. And when I checked the encounter forms, I realized they're just plain illegible. And these procedure codes are so complex, even I can't make heads or tails out of them. That means a 2-part error. The encounter forms should be completed carefully and legibly, and then double-checked to verify the information. The rest of the claims that I got back just are requests for additional information.
Oh, let me see. Yeah, I remember this guy. There were 3 different insurance companies involved, and a lawsuit involving his employer, and lots of changes in his diagnosis. You're right, it's definitely complicated. But I don't think a service could help. We know our patients best.
I hear you. You know, but we have to do something.
Well, let me take these from you first of all. You know that new MA, Jamal? He's very bright. Maybe he could help out in billing a couple of days a week, working the accounts receivable that have been denied.
I appreciate your dedication, Geneva. You know, the new service would be costly. I'll give it some more thought, and I'll call Jamal, too.
You're the boss. Don't stay too late.
Thanks. I'll process these new claims before I leave for the day and electronically submit them. And let's hope none of them come back to haunt us.
MA tip. Many of the reasons for claims denials are because procedure and diagnosis codes do not match up to justify medical necessity, or there is missing information. Sometimes the insurance company will delay a claim until they get a copy of the progress notes for the visit.
If a claim is ever denied and a patient brings that to my attention, I will take the initiative to contact that insurance company, find out why it has been denied. Maybe there was an incorrect coding that was done, and it should have been covered. So the patient should always understand to check first before they get a suspicious bill. Especially the elderly patients sometimes feel that they get a bill and that their insurance just didn't cover it. So right away they feel they need to write a check and send it off. And I think that's not good. I really feel that they should bring it to the attention of the medical staff so we can maybe correct it if there was a mistake.
When claims are submitted to the appropriate insurance company, it is wise to maintain a log or register of submitted claims. This claim log should include the name of the patient and the insured, the date of service, charges reported on the claim, and date of submission. Pat Morgan's claim is on its way to her insurance company, where it will be analyzed to make certain that coverage was effective at time of treatment. The physician has a current contract with the insurance company. There are no exclusions or restrictions on the policy for payment of the diagnosis. There are no pre-existing condition restrictions. The diagnosis made and procedures or services performed are reasonable and necessary.
So, Jamal, you've really caught on quickly these last few weeks. Are you ready for your first solo mission?
Aye, Captain.
Okay. All right. Here are the remittance advice notices that came in yesterday. And here's the stack of outstanding claims.
All right,
Go for it.
let's do it.
After the claim has been processed, the insurance company sends back a form called an Explanation of Benefits, or EOB. This form may also be called a Remittance Advice, or RA. EOB or RA forms include dates, charges allowed, deductible or copayment, coinsurance, amounts actually paid, and any charges denied or pending. MA tip. The patient will also receive an explanation of benefits from their insurance company. As Jamal inputs payments and adjustments, he uses a yellow highlighter on the EOB and sets aside any EOB that contains denied charges. MA tip. Yellow should be the only highlighter color used on RA or EOB notices so that when making a photocopy, the highlighted area remains legible. After dealing with all the straightforward claims, he goes back to tackle the problem claims one by one. This claim has been denied because the patient is not covered for a pre-existing condition.
I understand, Mr. Johnson, but you'll need to speak with your insurance company about it. Yeah, they say the history of your neck injury excludes you from reimbursement for this procedure, so we'll have to bill you. I know it's difficult to understand here. Let me see if I can explain it to you this way.
If there is ever a situation where a patient has been billed and we have tried to help them as far as dealing with the insurance company and trying to have payment, and the insurance company does not cover this certain service, then the patient needs to be explained and told that they would have to probably pay out of pocket if they have no other means of a supplemental insurance or so forth. And sometimes it's difficult in relaying that message to the patient that they have to actually pay out of their pocket even though they do have insurance. So that could be very disappointing. So you really want to make sure that you know all the different facts as far as the insurance, and have the patient be educated and have them educate themselves about what services are covered and what are not covered.
And here's a claim that contains an improper diagnosis code. The medical assistant should try to make the correction in the computer and resubmit the claim. But there is no remittance advice for Pat Morgan's visit.
Yes, the claim number is 21548. Patricia Morgan. That's right. So what's up? You mailed an EOB directly to her, but not a remittance advice to the office? Is that standard for your company? Oh, only when the claim is rejected. No, we just began participating with your insurance plan last month. Can you tell me why the claim was rejected? Let's see, well, can you fax it to me? Yes, that's correct. All right then. Thank you very much. Goodbye.
I can't understand why this claim was rejected. I have this form in front of me, but I don't really understand.
It seems the date of your visit was 2 days before the effective date of your policy.
Well, my husband was told that our coverage began 30 days from the date he was hired, and he's been there 3 months. Do you mean we're going to have to pay for all those tests?
Miss Morgan, I can understand why you're upset. I suggest your husband speak to the human relations person where he works, see if they can shed any light on this. Billing, may I help you?
I'm just curious, really. My husband's insurance was billed as the primary for our daughter who was in recently, but I listed my insurance as the primary.
Well, ma'am, the primary plan is usually determined by the birthday rule, which determines the first plan to pay benefits based on which parent's birthday falls earlier in the year. For example, your birthday is June 2nd and his is April 21st, so his insurance pays benefits first.
But I'm older than him.
Actually, it's the month and the day that are considered in the birthday rule instead of the year that the insured was born. Pretty confusing, isn't it?
So, I'm not sure if I owe you any money. It says only $50 was paid.
Ma'am, what was the date of service?
What?
When were you in the office? The date should be on the explanation of benefits. Was it June 16th?
Yes, that's right.
Well, your supplemental insurance only paid $50 because Medicare paid the rest, so you're all set, Miss Coe.
Oh, that's wonderful. And you're so nice to explain it to me.
No, I'm at the podiatrist right now. They say they can't see me without a referral from you. I guess I must have listed you as my primary care physician.
Well, have you ever seen a doctor at our practice?
No, that's what I'm trying to explain. My foot is killing me and I need to see a specialist right now.
I'll try to help you. What kind of insurance do you have?
PACE something or the other.
PACE Plan East?
Yes.
Okay, that's an HMO. They do require a referral. Let me switch you to the proper desk.
Patients oftentimes feel that their insurance, their medical insurance, is between you and them and the company. But that's not true. Actually, medical insurance takes place between the patient and the insurance company. And so oftentimes when they're very upset about something that's not covered by a policy or within a policy, if I have working knowledge about the policy or the type of plan, I am most definitely happy to share that with them. If I do not, then I definitely try to help the patient realize the resources they should go to, because you know how to read those cards. And so you can share with the patient, here's where you could call and they will be able to assist you with understanding your policy. If the patient doesn't want to call the insurance company, which is often the case because they just see that as this big industry, and here they are just the little patient, I will also refer them back to their employer. So I'll ask them, do you have an HR department? Do you have someone directly at work that speaks with you about benefits? Because who better also to help them understand the policy? Because the employer has agreed upon the terms of the policy.
Patricia Morgan? Hi, this is Jamal at Quality Medical. Guess what? Your insurance company found the error on your effective date of your policy. Yeah, the payment came. That's right, paid in full. I'm updating your account right now. No problem. You're very welcome. You have a great day, too. Take care now. Goodbye.
Medical assistants with responsibility for billing are one key to a thriving ambulatory care center. Billing the insurance companies promptly, completing claims properly, billing patients as needed, and keeping track of aging accounts will ensure an adequate flow of income to the practice. In all insurance matters, be available to patients with questions regarding their insurance or accounts. A friendly attitude helps patients feel positive about the care they receive and establishes a long-term relationship.